My name is Michael Missler. I'm an interventional cardiologist with Cardiology Diagnostics. For our patients, we offer practices at Missouri Baptist, Barnes Juice St. Peter's Hospital, as well as Progress West. And we now have a cardiac catheterization suite at Progress West that offers acute MI care as well. You know, I spent some time working in central supply in one of the local hospitals where this group actually worked. And I had already met partners in the group at the time. And it gave me a kind of an inside opportunity to spend some time observing cardiology procedures and working with cardiology patients. And that got me interested in cardiology. One of the other aspects that got me interested is my grandfather actually started having problems with cardiovascular disease when he was in his early 50s. And so I was able to see what new procedures and research offered him, and it improved his quality of life and allowed him to live well into his 90s. Well, besides the obvious of having them have a good knowledge base, communication skills I think are the most important. Having a physician that will sit down and take time and listen to you. With medicine now and the way everything's changing, the amount of time we have with a patient is limited. But it's just, you learn way back in med school, if you listen to the patient, they'll tell you what's wrong. The most rewarding aspect of being a physician actually goes back when we were interviewing for med school. One of my friends was asked a question, you know, what's the mortality rate? And the answer is 100%. And so the next question was, well, then why bother? And actually, it's because you can improve somebody's quality of life. And in some aspects, we can make them live longer. And so that ability is very rewarding. Specifically in cardiology, what's nice is that being an interventional cardiologist, the fun thing I find the most rewarding is somebody comes into the hospital in acute distress with an acute myocardial infarction, and we're able to take them to the cardiac catheterization lab and basically reverse the process, open up their artery, make them pain-free immediately. And that's very rewarding. You know, there are so many things that one needs to do to maintain a healthy lifestyle. It's multifaceted, they're all intertwined. And I think it's important to be active, to keep moving. Exercise is so important in your daily activity. It helps both your physical and mental well-being, and so I'd say exercise. My family's from here, so I was born and raised here. And the group I'm with, I actually met one of the partners back when I was in high school. And so I had been talking with them throughout my whole training experience. And I thought it was a good opportunity, so I came back after a cardiology training. If you'd like to find out more information about myself and my group, feel free to access BJCmedicalgroup.com or healthgrades.com. You can reach our office at 636-916-7272.